Peter Faustino and Shawna Rader Kelly about mental health and remote learning in students. And why don't you both just take a second and please introduce yourself. Peter, why don't you go first?
Sure. I'm Dr. Peter Faustino. I'm a school psychologist practicing in a public school system in Westchester County, New York, and I'm officially the New York State delegate to the National Association of School Psychologists.
And I'm Shawna Rader Kelly. I am also a school psychologist, and I work in the public schools in Bozeman, Montana. And I'm currently serving on the NAS Board of Directors as the strategic liaison for professional advocacy.
Okay, and as I mentioned earlier, we're going to talk about mental health and remote learning. Obviously, there's a big concern with a lot of students out there right now. Maybe you should maybe talk a little about what educators should be thinking about right now in terms of connecting with their students and what to be aware of right now in terms of mental health.
Some issues that I think we're dealing with around equity and access to the technology when we look statewide here in New York, and certainly, Shawna and I get to compare notes about different states across the country. So there's a technology access and equity issue. There's professional development issues that I think we're struggling with for the adults. So, everything from the basics of using the technology to, pitfalls around, doing some of this work with the students. And then, I'm sure as we'll talk about, I've made some observations myself just about the way, kids are accessing, I think, even the technology. And what I mean is, partly because we're still in the pandemic, I worry that as time goes on, the kids are beginning to show more and more symptoms of mental health concerns. And so we are probably needed now more than we were in the very beginning. And at the same time, we're developing these issues where we're trying to get kids to log on or to get out of their bed or to stay connected using the technology. And so, yeah, we're still in the thick of it. But
yeah, I would agree with Peter. I think that it's an emerging issue. It is certainly not one that we were necessarily prepared for. And I don't know that there's necessarily a target that we reach. I feel like it's an evolving process because every day is a new day, and there's a lot of uncertainty about what a potential return to school looks like and when that could occur. And I think that makes it especially hard as educators to plan. I know personally in my school, and I think in many schools, we have very well defined and clearly articulated protocols about how we respond to student mental health needs. And those were not necessarily readily adaptable to this mental health work that Peter is talking about. So I think we're continuing to evolve and learn from our practices, and hopefully apply what we know about best practices in working with children and students generally, and how we respond to mental health needs from children and students generally to this setting. And hopefully we just continue to learn from this. And one of the things that we're great at as school psychologists is engaging in our problem solving process. And so I feel like that's what I'm doing a lot, is just trying to understand what's not going well and then trying to do it better the next time around.
I love that.
So along those lines, what are maybe some things, for non-school psychologists, but educators on the list that maybe they should be either aware of or looking for right now with their students? Maybe kind of, I don't say red flags, but just things to be aware of and kind of, concerns things to be cognizant of.
Ray, you mentioned the issues related to access and equity of access. And I feel like when our schools first closed, that was the first thing that we were trying to troubleshoot, is how do we ensure that our students had access to computers and technology devices, and who had access to the internet so that they could engage in the work. And that seemed to be the focal point at the early onset of this. I feel like now, at least in my area, I feel like we've been able to address that for the most part, and we've been able to get paper packets and things like that. We've been able to adapt to students who may not have access to those kinds of things in the long term. And really what I'm encouraging teachers to do, and parents as well, parents and families, since they're on the front lines of this too, is to be aware of kids who are still not accessing, despite having the access to the technology or to the resources in whatever way they've been delivered to them. Because I think at this point, that lack of engagement speaks more to issues that maybe student-specific issues that aren't related to the technology or to the devices. So while that was the first area of focus, now I'm concerned about those students who are continuing to not engage with their teachers or with the educational materials, even though we've maybe solved that problem of access. To me, that could be an indicator of some mental health concerns.
Yeah, I completely agree. And if we whittle it down to maybe even a finer tuned level, I'm having a lot of conversations with teachers who are saying this student will sign on but not enable their video, or sign on and not enable their audio. And I have no way of determining if they've gone to another room, if they've checked out, if they simply signed on to acknowledge that they were in attendance, but really were not attentive or engaged in any of the learning. Sometimes I think teachers are even reaching out to say, I'm noticing that this child is in their bed when they're, signing on to the classroom, and that doesn't feel like such an appropriate, sort of setting to do the sort of class lesson or the engagement that sometimes the teachers are looking for. And I think the other observation is around scheduling, and just, that we take it for granted that schools are set up with a start time and bells and structure as far as when you are doing one activity or another, or the teachers organize it in that manner.
My sister, who is a principal in a school district here in Connecticut, kind of an economically challenged one, has talked about the idea that for a lot of students, school is sanctuary, right? It's the place where they actually get good attention. It's where they get meals. It's where they kind of feel safe. How are maybe some thoughts about how districts maybe should be addressing those students, or kind of looking to those students? I mean, you touched upon a little with kids that are in bed and not engaging, but is there maybe anything you can suggest in terms of kind of maybe reaching out to those populations?
My immediate answer would be that I would say my practice has shifted to a lot more family work and parent work, just for exactly what you described, Ray, in the sense that, when I talk to kids, they will often say things like, school is the best part of my day, or I've had other kids when I'm sort of asking them, like, what do you think of this e-learning? And they say, well, we'd rather be back in school. And we never thought we would say that to, a teacher or an adult. And I think it comes because of the amount of resources that schools have set up to provide all of those, supports, whether it be food or emotional security or check-ins and the such. So I think, to answer that question, for the students that we're really starting to get concerned about, I find that I'm reaching out to parents, setting up maybe even some time to talk to them about, hey, have you thought about this type of schedule? I work primarily with like a teenage high school population, and it's kind of amazing the number of parents that will say, I just assume my child would be self-sufficient, and so an entire day can go by and I don't check on what they're doing in their room or in the space that I set up for their learning. So other than maybe dinner, there isn't that same level of connection, human connection, that you would get in a school building where there's just, dozens of teachers and dozens of staff members and support people, as well as peers and friends. And so, yeah, just sort of, looking to create a small modicum of that in the household is, I think, what we've been shifting to do.
I think if there's one thing that the pandemic has done, is that it's really shined a light on all the things that schools do that are not directly related to education, but that support successful education. We typically get students to school on time at a structured time. We provide busing and transportation for children who might not otherwise get there. We provide meals during the day. There are a number of other kinds of supports, including mental and behavioral health supports like Peter and I provide in schools that help to support students in accessing their learning. And it's not just about the delivery of the instruction that supports learning for those students. It's the myriad of those supports that come together. And I think that's the thing that's been the most difficult to replicate. I think most school districts are finding some way to try to ensure that kids continue to have access to meals while they're out of school or while the schools are closed. But that alone doesn't account for all of those things that they would typically access in the school day. And so I think it's really shining a light on how comprehensive education truly is. I've heard from parents like Peter has mentioned who have said that they're struggling with establishing those schedules at home. And then frankly, I work with a number of families where it's just outside of their capacity to be able to provide those structures. They might not even be able to provide that learning environment like Peter referenced. There might be several students or even several families that are living together in the same place. They're sharing workspace, they're sharing devices, and frankly, we have some families who are in crisis too. There are economic impacts that are impacting families, and so I think there are some families who are taking advantage of this time and planning activities together and really relishing this time at home and this change of pace, and that is just not the same situation for some of our students. And so I feel like a lot of my work with teachers is helping them to understand the context that many of our students are working in, and to understand that the educational priorities for that family may not be the same as for some of the other students that are in that class. And we talk about how we can adapt some things to support those students, and what they need might not be the academic part of the education. It's the connection and the relationship part of the education. And I also agree with Peter's point too, that I feel like a lot of my work with students has shifted from the direct one-on-one support to the student to the consultation, the collaboration with the family to try to support them in being the frontline educator for their child, because that's not a role that they're used to. And as a parent, it's not a role that I'm used to, and I'm adjusting to it. So yeah, I think the way we've shifted our service has looked a little bit different in recent weeks.